Okay, welcome everyone to our next lecture in our series of lectures about disabilities and disorders as it applies to education support workers, teacher aide, teacher assistants, childcare workers, those types of positions. Now, Tourettes Syndrome is the one we'll be talking about today. We'll hopefully get through this one relatively quickly because I think it's probably not the most common one that you'll come across, and certainly it's more aligned with the medical requirements of children and not so much aligned with the educational strategy type of stuff that we've come across in a lot of the other disabilities and disorders. So, for example, dyslexia and ADHD, autism require a lot of additional support on your part as educational professionals, whereas Tourette's doesn't necessarily mean there'll be any social issues or social problems, behavioural problems, learning disorders, those types of things. It doesn't mean that there'll be issues with so a low IQ or learning disorders or anything like that. So you may have children in your class that, or school or childcare centre or whatever, that have Tourette's, and you may not need to give them much support whatsoever. But in saying that, obviously this would be a type of disorder that means the child stands out quite a lot. So there are things like bullying and social problems that can come with it. But that's a discussion for another day. Okay, so I'd just like to remind you that while we do go through all these disabilities, the medical side of it, we don't necessarily concentrate on that much. But I do recommend, if you are working with kids that do have a particular disability or disorder, please go down the path of researching that disability or that disorder, because it is very important that you are aware of and have as much information as possible about the children who you are working with, because it will make your life a lot easier and certainly improve the educational outcomes of the child, and certainly that information flows from you to your colleagues and to teachers and to other children and parents and so on. So Tourette's is a neurological condition. So again, that word neurological has got something to do with the brain, so it's happening in the brain. That is noticeable by the rapid, repetitive and involuntary muscle movements, usually referred to as tics. Now, if you're not sure what Tourette's looks like, please go on the internet, go to YouTube, type in Tourette's Syndrome and watch 3 or 4 videos, and it'll give you a very good idea. 90% of people with tics also have another disability. Okay, so Tourette's Syndrome. What exactly is Tourette's Syndrome? In 1825, Jean-Marc Gaspard Itard, a French physician, first described the behaviours. So now Tourette's is the same as autism. It's not that it hasn't existed for thousands and thousands and thousands of years. It's just a case of when was it first recognised officially by psychologists and the medical fraternity, I guess. Sort of like gravity. Newton didn't invent it. It was always there. It's just a case, when did someone actually decide that it was actually a syndrome and that needs to be classified and studied and so on and so forth. 1885. That person there with that French name began his research, and notice that there's about 60 odd years difference there, which is quite a long time. The brain sends messages of rapid, repetitive and voluntary muscle movements and vocalizations called tics. Yep, we already know that. Behavioral difficulties can occur, sometimes, but however, it does not affect intelligence. Only 20% of children with tics will develop the actual Tourette syndrome. So they get to the point where it's an actual syndrome that's significantly affecting their life. So obviously tics can be minor. They can be things that you may not really even notice. I have had children before that have said, and you might have friends, for example, that say they have a tic, but it doesn't necessarily mean that they would affect their work, and in some cases, until they actually told you, you wouldn't even be aware of it. Okay, the diagnosis procedure, which is relatively simple for this one because a tic is a tic. I mean, it's relatively obvious to most people. Of course, being diagnosed formally with Tourette's Syndrome is a whole different kettle of fish, and the problem is with Tourette's is that in general it's not like autism or ADHD where it's very well known. It's not necessarily a learning disorder. It's not something that's going to attach a lot of government funding, so you won't really see too many education assistants who are assigned to work with the child because that child has Tourette's Syndrome. And in fact, I've never seen that before. I don't think it would happen very often. But of course, as we know with disabilities, is that we go through and we learn about these disabilities individually. But as you would have realised so far, that in most cases, when you're actually in the field, in schools, in childcare centres, things like that, you're not dealing with one individual disability or disorder. You're dealing with multiple disabilities and disorders. Okay, now, as a general rule, to have Tourette's syndrome, a person will need to have at least one vocal tic and at least two or more motor tics. So motor tics are obviously got to do with the actual physical body, whether it's facial features or whatever. And over a period of 12 months. But again, it really depends on the individual person, and it's not really relevant to us, the actual diagnosis and how that occurs. It's really more about looking at what type of strategies we need to put in place in the school or in the childcare centre. Okay, sometimes video is used, and neurologists and GPs and people like that. Okay, 3 to 4 times more common in boys. I've noticed that with quite a lot of the disabilities that we cover. Not sure if there's a reason behind that. Maybe a GP or someone would know the answer. Usually diagnosed around 8 or 9 years of age. Symptoms vary, as with every disability. Some behaviours are not beyond controllable. And providing a supportive and accepting environment is crucial for positive self-esteem. Everyone is different, and so is the variety and complexity of the tics. They can be categorized into 2 types, simple and complex. Okay, now simple tics involve a limited number of muscle groups. So they're generally, I suppose you could say they're single occurrences such as eye blinking, head or shoulder jerking, grimacing, facial grimacing, nose twitches, throat clearing, barking noises, squealing, grunting, tongue clicking, sniffing. Whereas complex tics involve more muscle groups and more muscle groups in more of a coordinated sort of fashion, so possibly more gross motor type things like falling over on the ground and those types of things. So under the motor, I suppose, category, jumping, hopping, bending, twisting, touching, or sniffing other people and things, repetitive movements of the torso or limbs, facial grimacing combined with head twists and shoulders or shoulder shrug, pulling at clothing, and self-harm, including hitting or biting oneself or other people. Uttering words or phrases, coprolalia, involuntary, socially inappropriate words. That's probably the typical one that you will see in movies and things like that. Echolalia, repeating back sounds, words or phrases, which has just been heard, or repeating words over and over again. Okay. Trying to stop a tic, which is obviously not that, going too far. Obviously not that easy. It's obviously very difficult to do, and it can cause mental exhaustion, tension, and possibly cause additional problems like a bigger, more serious tics. Okay, can the frequency increase? It can, due to tension and anxiety, stress, hunger, tiredness, changes in physical health and other disorders, things like that, excitement. Okay, so how can you, go past it again. How can you decrease tics and the frequency and severity? Relaxation is one technique. Concentrating on absorbing the task, so being engrossed in a particular task. Talking very general here, of course. What treatment is available? Generally, there's no medication for general suppression, although I was doing a bit of research earlier today and yesterday looking at the different types of medication, and there are some medications available that are quite common, especially if the Tourette's syndrome does get quite severe. So there are obviously medications available, but it depends on the actual individual, of course. And again, it's not something that really matters that much to us as far as working in schools, childcare centres, things like that. Family and peers are taught to ignore their actions, or not so much ignore. I mean, it really depends on what's going on, but to work with the person and to help with different strategies and so forth. Symptoms interfere with daily function, then medication is given. Cognitive behaviour intervention, so different types of therapies. And there's lots of different types of therapies out there. That's something that you can research. It's a little bit beyond the scope of what we're doing here, so I'll go through these relatively quickly as well. Impacts in the classroom and impacts for learning. So excessive interruptions from movement. Reaction of peers, so things like bullying and teasing is very common with tics. Or people that have tics, people that have Tourette's syndrome. Poor impulse control, in a sense, can be an issue, which is quite obvious because that's sort of the definition of a tic in a way. Inconsistency with performance, difficulty staying in the seat, poor organisational skills, calling out, task avoidance, and avoiding group work and things like that, avoiding going to class. You can imagine, for example, a teenage girl and the issues she would have if she's shy, or even if she wasn't shy, but the peer pressure and the always being the centre of attention because of a particular tic could make someone very, very anxious and make them very distressed. Slower speeds for reading, quite obvious, and I mean pretty much any task. Transferring ideas between mediums, so talking about discussing things and then writing them down on paper and so forth. So concentration skills, difficulty retaining information, completing tasks within a set time frame, panic attacks. Handwriting obviously can be a little bit more messy or sometimes impossible, depending. Missing information and suppressing a tic makes concentrating on a task quite difficult. People with Tourette's are more likely to have other disorders, the OCDs, ASD, various sleep disorders, difficulties with impulse control. I do know sleep disorders are quite common. In fact, I was just watching a few YouTube videos before I did this presentation, and one particular person was talking about the medications and things like that they have for their sleep disorders. So I think that's relatively common for people with Tourette's, ADHD, and various other learning disorders. Classroom strategies. Okay, so with permission, educate peers and other staff about the syndrome. That's very important because, and I think that goes without saying for every disorder, is having a buddy system. Normally, children with a disability will have someone that they work with quite closely. They may have been in the same class with them for many years, and quite often they will know more than you about the student, about how they socially are going, whether they have and panic attacks and things like that. A distraction pack, have substitution or distraction items like sensory items, elastic bands, stress balls. Provide the learner with a safe space to go if the tics become severe. Okay, and then they're starting to feel anxious and things like that. Focus on building on their strengths to reduce anxiety. On-task reminder system. And again, as we spoke about in the last lecture, being creative. So especially for these type of disorders where different children have different interests and different abilities, being creative is very, very important as far as the strategies that you use, the way you change tasks around to suit the particular student so that they can be successful, to reduce their anxiety, to help them survive the day and to help them learn and acquire new skills and knowledge. All right, delivery strategies. So a delivery strategy is simply the way in which you take a bit of information, say you want them to learn algebra, and how you get that information across to them. So we all know what strategy means. Delivery means you're delivering information from in your head to their head. Okay, so you're trying to teach them something new. That could be a skill, it could be a bit of knowledge. It could be a variety of different things in different subjects, for example. It could be kicking the football, or it could be learning how to write a sentence. Extra breaks for refocusing is very important with a physical energy release and so obviously, for example, you may get them to stand up and go get a drink. So sometimes if kids are jumping up and down, they've got heaps of energy. One thing I used to do is say, okay, well, let's go. Well, you can go and get a drink, but when you come back, I expect you to be calm and to be working. We'll start from scratch, and you've got 20 minutes left till recess, and I want to see you working flat out till for those 20 minutes before you go on break. Does that sound like a deal? And the student will say, yep, deal. And then they'll go off and they'll have a break for a couple of minutes, get a bit of fresh air, come back, put in 20 minutes of work, and off they go. And again, I always say sometimes we expect way too much of children. I mean, I have problems myself concentrating. Sometimes you just have one of those days where you just can't get into it. You don't want to do the task. You're avoiding it. You find other things to do. But sometimes as adults we can be very unforgiving towards children when they are in those same types of moods. An on-task reminder system, handouts instead of copying instructions. Set student away from distractions like the door and windows. Help organise students at the beginning of the day and before activities. Visual or non-verbal on-task strategies. I think these types of things go for all children with disabilities. There's nothing really specific in there for Tourette's. Extended time for tests. Break long tests and exams into smaller parts. So 10 minutes here, 10 minutes there, over a number of days, for example. Consider alternative forms of assessment, so verbal assessments, for example, scenarios, what ifs. To reduce wasted energy trying to suppress the tic, provide a private room. So they may, have a little space in the wet area in between all the classrooms or whatever where they're doing, where they work after lunch for the last hour of the day, because the student has a problem with their tics, particularly after lunch for whatever reason. I'm just making this up. But so in that case, the strategy might be to give them a bit of extra time. Well, I hope you've enjoyed that lecture. We got through that one relatively quickly. And I look forward to seeing you for the next lecture.